In this video, we're going to go through the major systemic arteries. I'll remind you that these arteries are going to begin at the aorta and then lead to either a region of the body or a specific organ. At that region or organ, the arteries are going to lead to arterioles and systemic capillaries where the oxygen and nutrients are delivered. And in those same capillaries, they will pick up carbon dioxide and waste. And then we're going to have to learn how that blood gets back to the right atrium, looking at the systemic veins. So typically what we do is start with the aorta. Remember, the aorta came out of the left ventricle. So we went through the aortic valve. So you can imagine the aortic valve would be somewhere around here. And the blood will enter what's known as the ascending aorta. Blood is going up, so it's the ascending aorta. And the first major arteries off that ascending aorta we already learned. They are the right and left coronary arteries. So they're not shown on this drawing, but you can imagine there's going to be a little right coronary artery coming off of the right side of the aorta and a left coronary artery coming off the left side of the aorta. And those supply the heart with oxygenated blood. If you don't go out those, your next option is you enter what's known as the aortic arch or arch of the aorta. And there are three major systemic arteries that come off of this arch. So what we want to do is kind of learn them in order. So the first one is known as the brachiocephalic trunk. If we look at that name, it suggests a couple things. Brachio is the arm, so some of that blood is going to head towards that right arm. And then cephalic means head, so some of the blood is going to head towards the head. So that's the brachiocephalic trunk. Trunk typically means it's an artery that's going to split. We already learned about the pulmonary trunk, so it suggests that it's a pretty big artery, but it's going to split almost immediately. And the two splits are the right common carotid, so that's going to be the one carrying blood towards the head, and then the right subclavian, which is going to be carrying blood towards the arm. Now this one's named subclavian because it goes underneath the clavicle. This drawing doesn't show a clavicle. This is the first rib, but the clavicle is going to be just over top of this subclavian artery. The common carotid heading towards the head, we're going to see in a minute that it's going to split into an internal and external carotid. And that's suggested by this common. So whenever you see the word common, that also kind of gives you an idea that at some point here it's going to split into two. So that's the first artery off the arch. And we'll look at what happens to that common carotid and that subclavian in further slides. But if you don't go out that first branch, you're going to go out the second one, which is known as the left common carotid. If you don't go up that one, you're going to go the left subclavian. So notice what's going on here. There's three arteries off the arch, but on the right side, they split into carotid and subclavian, whereas on the left side, they're independent from one another. So that's why there's three arteries and not an even number. So there's only a brachiocephalic trunk on the right side. All right? But once the blood enters a carotid, it's going to do the same thing it does on the right and the left. When blood enters subclavian, it's going to do the same thing on the right and the left. If you don't go out either one of those three arteries, you're going to head down the descending aorta, and that's called the thoracic aorta when it's in the thoracic cavity. And then it can go through the diaphragm, and it becomes the abdominal aorta. So you'll notice it's all the descending aorta, but above the diaphragm it's thoracic, below the diaphragm it's abdominal. Okay, so let's see what happened or happens to that brachiocephalic trunk again. So there's the brachiocephalic trunk. We're kind of looking at the right side here. So the arch of the aorta would be coming up and arching. So this is that first artery off the aortic arch. We already learned what happens. It splits into a subclavian. All right, and that's this one here. It's heading towards that right arm. All right, here is actually the clavicle, and it's going to kind of dip underneath that clavicle. So there's the subclavian. There's the common carotid. There's a really important artery. It doesn't look that important because it's not very big, but it comes off of this subclavian and goes up through the cervical vertebrae. If you remember, those cervical vertebrae have these extra holes on each side called transverse foramina, and that's where this vertebral artery goes, through those transverse foramina of the cervical vertebrae. Then we notice that it disappears. It disappears because it went into the cranial cavity, and it's going to help supply blood to the brain. So next thing we want to do is follow that common carotid. All right, so here's that common carotid, and here is where it splits. So one of the branches becomes the external carotid, and then the other one becomes the internal carotid. The difference being the external carotid is going to supply tissue outside the cranial cavity. So it's going to supply facial muscles, skin, teeth, and anything outside of that cranial cavity. The branches that come from the external include the facial artery, the maxillary artery, which we just see it coming off here, and it's going to go and kind of supply more of this region of the face. There's a superficial temporal artery right here, and supplies all this tissue on kind of the side of the skull. And then there's an occipital artery. So those are all branches off that external carotid. The internal disappears on us. Just like the vertebral, it's going to enter the cranium and supply blood to the brain. So this is the base of the brain. All right, so we're looking up at a brain, and we're just going to now see what happened to those two vertebral arteries and see what happened to the two internal carotid arteries. So we see that on each side of the spinal cord, all right, so here's the spinal cord. This is all brain stem. If you remember your brain anatomy, this is the cerebellum, and this is all cerebrum. So the two vertebrals come up on each side of that spinal cord, right? Because they're going up those holes in the cervical vertebrae. What they actually will do once they enter the cranial cavity, they merge into one artery. They merge into what's called the basilar artery. All right? So there's where the blood is coming from the vertebrals. The two internal carotids are coming up your neck. So we kind of see those entering up into this area of the brain. And then they all connect to one another. So notice that there's a circular arterial blood supply here called the circle of Willis. So what that is, it's a way to have collateral blood flow to the brain. What that means is you can have multiple arteries supplying a specific area of the brain. So you've got 4 arteries, 2 vertebrals, 2 internal carotids. They're all connected together, so it really doesn't matter how the blood gets to this circle, but as long as you've got blood in the circle here, you can get blood to any part of the brain. So how these arteries are connected together are using what's called communicating arteries. So notice this posterior communicating artery connects the basilar to the 2 internal carotids. And then there's an anterior communicating that connects here and forms this nice circle. So as long as you can get blood in that circle, you can send blood out of the circle to the brain. And that's done using the cerebral arteries. There's anterior cerebrals, there's middle cerebrals, and posterior cerebrals. So what I tried to do is color code these. So the arteries that are shown in red are bringing blood into the circle. The arteries shown in green are kind of forming the circle. And then the arteries in black are the ones that bring the blood out of the circle to specific areas of the brain. So the anterior cerebrals are going to supply most of this area here, kind of shaded in yellow. The middle cerebrals are going to supply more of this area, shaded in kind of a pink color. And then the posterior cerebrals are going to go to this part of the brain. All right, so this is blood flow to the circle of Willis and then from the circle of Willis to the brain. Next, let's look at that arm. So we go right back to that brachiocephalic trunk again. It came off the arch of the aorta. We see the common carotid, which we just saw where it went. There's the subclavian again. Now we can actually see that it dips underneath the clavicle. All right, so there's the clavicle, it goes underneath the clavicle. Then we have to change the name. So a lot of arteries have the name changed based on the region. If you're using a regional term, such as subclavian, but it's no longer under the clavicle, you really have to rename it. So this one goes through the armpit, so it's called axillary. Remember, your axilla is your armpit. Then it goes out of the armpit and goes into the arm, so we call it brachial artery. And that's an important one. That's a common one we use to measure blood pressure. And then the brachial artery divides into a radial and an ulnar artery. And those should make sense because the radial artery runs along the radius, the ulnar artery runs along the ulna. And the radial artery is significant because it's a very common pulse point where you can take a pulse. All right, so then if we were to look at the left common carotid, it's going to, again, basically do what the right common carotid did. And then if we look at the left subclavian, that's going to do basically what the right subclavian did. So we're done with the arch and its three branches. We head down the thoracic aorta, and you're going to have arteries that go to things in that thoracic cavity. For example, we're going to supply the pericardium. We're going to supply bronchi and bronchioles. Those are airways. We're going to supply the esophagus and anything else inside that thoracic cavity. We're going to supply basically the wall of the cavity using intercostal arteries, subcostal arteries, and then we're going to go and supply the diaphragm using superior phrenic arteries. All right, so those are all branches off the thoracic aorta going to things in your chest other than the heart, because the heart we took care of with the coronary arteries. So now let's go into the abdomen. So the aorta goes through the diaphragm. All right. Immediately we have some more phrenic arteries because we got to supply blood to the bottom of the diaphragm as well as the top. So the superior phrenics lay down on top of the diaphragm. The inferior phrenics go up to the bottom surface of the diaphragm. Then we get to a very large artery as far as diameter called the celiac trunk. So right here is what's known as the celiac trunk, and it splits into three arteries. So there's the name of just this little part here. You can't really, I didn't put an arrow on it because it's really hard to tell that there's actually just one artery coming off the aorta here, but it almost immediately splits. And the three arteries of the celiac trunk include the splenic artery. So you'll notice that one's heading over to the left because the spleen is going to be over here on the left. There's a left gastric artery, which is this middle one, because the stomach sits right about here in your abdomen. And then there is the common hepatic, which you'll notice is heading over to the right because the liver makes up a lot of this right upper quadrant over here. So if you know the big three organs in the top of your abdomen, this should make sense. You've got liver, stomach, and spleen in that upper part of your abdominal cavity. So those are the three branches off the celiac trunk. If we don't go out there, we'll continue down the abdominal aorta, and maybe we'll go to the kidneys. So there are renal arteries. So here's a right renal artery supplying the kidney. Here's a left renal artery going to the left kidney. Now those are pretty big arteries compared to the size of the kidney, because that blood isn't just nourishing the kidney, it's getting filtered, right? So we send a lot of blood to the kidney, not because it needs a lot of oxygen and nutrients, but because its primary job is to filter out waste and get rid of anything that is in excess in that bloodstream. So those are the renal arteries. There's an artery, another big artery, called the superior mesenteric artery. Mesenteric is in reference to your intestines, especially the enteric portion. Mesentery is tissue that kind of holds all the intestines together, and in that mesentery are these blood vessels. So this superior mesenteric artery supplies a lot of blood to your small intestines, that's a lot of organ. Your first part of your large intestine, called the ascending colon, the middle area of your large intestine, called the transverse colon. So that's all supplied using the superior mesenteric artery. There are gonadal arteries. So we don't know if this is male or female, so we just call them gonadal. But if we knew this was a female, we'd call them ovarian arteries. If we knew this was a male, we'd call them testicular arteries. And those arteries come off way up by the kidneys because that's where these gonads form. And then as the body develops during fetal development, the gonads actually descend down, and the ovaries will stay in the pelvic cavity, whereas the testes will exit and enter the scrotum. Inferior mesenteric takes care of the rest of the intestines. So basically the end of the large intestine is supplied with the inferior mesenteric. There's a little artery that comes down here, goes down the middle of the sacrum, so it's called median sacral artery. Then the aorta splits. And when the aorta splits, those two arteries are called common iliac arteries. And common suggests that it's going to split again. And it splits into an internal iliac, which stays in the pelvic cavity. And then the external iliac is going to exit and go into the leg. All right. So these are the arteries off the abdominal aorta. Again, the celiac trunk has 3 branches. Together, those 3 branches all deliver blood to the stomach, spleen, but also the pancreas, liver, and part of the first part of your small intestine called the duodenum. Then the mesenterics take care of the rest of the intestines. All right. Let's see what happens at the end of the aorta. So here's the end of the aorta. We see it splits. So those are called common iliacs. We see the internals right here. But then the external is heading out of the torso, if you will, and enters the leg. And once it enters the leg, the name changes. It's called the femoral artery. It's going to start in the front of the thigh. So this is the anterior leg. This is posterior. So it's not right and left. We're looking from the front and then from the back. So it starts in the front, but it wouldn't be smart to go over top of the patella. So that femoral artery then kind of wraps to the back, and we see it back here behind the knee. And when it goes behind the knee, it's called the popliteal artery. Popliteal is the region behind your knee. After it goes below this knee area, it's going to split. And it splits into an anterior tibial, which goes back to the front. So now we're back into the front of the tibia. And the other branch is the posterior tibial, which goes down the back of the tibia. So you've got an artery in front of your tibia and back of your tibia. The one in front of your tibia is going to enter the top of the foot. The top of your foot is the dorsum. So that artery is called the dorsalis pedis artery. and then it's going to split into a bunch of little arteries on the top of the foot. The posterior tibial is going to go down and cover the bottom of your feet, so it's going to form what's called plantar arteries. And then there's an artery that comes off of that posterior tibial and goes down the fibula, and that's called the fibular or peroneal artery. So you'll notice a lot of these arteries are named pretty logically. If you know a little bit about the bones of the leg, if you learn that popliteal is the region behind the knee, and then you might want to know that the top of the foot is the dorsum. So dorsalis pedis means top of the foot, and then bottom of the foot's plantar, but we're not going to go into those. All right, so what did we just do? We went to basically everything. We sent blood up to the head and neck. We sent blood to the arms. We sent blood to organs in the thoracic cavity. We sent blood to organs in the abdominal cavity, and then we went down the legs. So the next thing we're going to do in the next video is talk about how this blood that now has become deoxygenated, how does it head back to the heart and eventually enter the right atrium. All right, so we'll do the veins in the next video.